what we're going to go through this morning is understanding some considerations before you start chemotherapy treatment in a patient, how to safely handle chemotherapy drugs, how to protect yourself and protect the patient.
The Muhimbili National Hospital and the Muhimbili University of Health and Allied Sciences, in collaboration with experts from the University of Oxford in the United Kingdom, conducted a training on systemic anti-cancer treatment administration.
Kwanza napenda kuwakaribisha wote katika mafunzo haya ya wiki mbili ambayo Hospitali ya Taifa ya Muhimbili inayatoa kwa watu wa huduma wakiwemo manesi na madaktari, wafamasia na watu wa maabara, kwa wataalamu wetu ambao wanatibu au wanahudumia wagonjwa wenye saratani na hasa saratani ya damu.
Some of the drugs where we know that you might get a reaction from, so for example rituximab, you've got to factor in the pre-medications first, so you wouldn't want to give the pre-medications and then a big gap. So it's about kind of the time management and the pre-medications going at a timely amount of time prior to starting the administration.
It's a 2 weeks course, and as I said, only a couple of days are very theoretical. The remainder of the course is aimed towards a practical application.
I'm attending this program of BMT because initially we are going to start this. Currently we are going to prepare the bone marrow transplant to our patient in Tanzania. So we get tutors from up countries in order they can teach us how to do the bone marrow transplant.
Finn Tyso is a lecturer in cancer care at Oxford Brookes University. He is explaining the aim and the purpose of the training.
I find that the students have been very engaged. They know far more than we ever imagined that they would know. I'm very impressed with their skills. They are taking on the information that we're giving them. They're showing that they're learning, and they're taking full responsibility for that learning. So one of the things that we've given them is a workbook to help them to bridge the gap between all the theory we're giving them and the actual practical experience on the ward. And they seem to be taking to that well. They're working in groups and they are completing it in their own time or in free time within the timetable.
And how is the training set? And how do you ensure theory is turned into practice? How knowledgeable and experienced are the trainees on hematology and other hematological malignancies? Finn Tyso echoes these observations.
Obviously, a lot of the content in the course is focused on Britain because it's focused on a British experience. However, most of the basic core principles apply to any area. We've also been talking to them about how they can take forward the things that we're teaching them in a way that's relevant to their specific areas. And we're very keen to help support them in doing that beyond the end of the course. So to that end, we've set up WhatsApp groups so that they communicate with each other and also with us. We've provided resources beyond the end of the course so they can access the lectures once we're gone. We're also talking with them about how they can start to do things like put together spillage kits, put together extravasation kits, so that they can start to have clear, governed clinical practice.
How unique and how relevant is the training? Participants had this to say about the training.
We have learned on the importance of communication, or on how to communicate with the patient taking those treatment. For instance, the patient on chemotherapy. So how to communicate? We normally use those normal communication or how to communicate with the normal patient, but we have learned some new things, or we have added something on how to communicate with those patients.
This training is quite different because I've learned some things which we are in deep. For example, the classifications and different types of chemotherapy drugs and how they act in the body, how they act in to prevent cancer cells growth and destroying the cancer cells, which is very interesting because now I know what I'm doing. It does to destroy these cancer cells.
All trainees have had some prior knowledge and experience dealing with cancer. But it is interesting to know what extra knowledge has this training added. The training marks the beginning of a long journey towards proper treatment of cancer in Tanzania. And what are the short and long-term recommendations for sustainability and continued capacity building? Professor Ann had this to say.
Have an interest in developing research activity in global hematology, and that's a fairly new speciality. And it comes really from the fact that we all know that there's an increase in non-communicable diseases, including cancer and hematological malignancies across the world, including in sub-Saharan Africa. As patients live longer, they increasingly suffer from these conditions. So the aim really is to build capacity to try and start treating patients who could be cured. So for that we need to identify those types of cancers and blood cancers that we can relatively easily treat and that have very effective therapies.
Ideally be administered in a ward area where again they have specifically trained nurses. And just for our understanding, where in this hospital do you administer chemotherapy? Is it just on the hematology and oncology wards, or do you see administration outside of these areas? My recommendations are that they try and take away from this the importance of nursing assessment and an understanding of how they can help support patients going through a chemotherapy regime and, most importantly, a bone marrow transplantation. I think if they can take away an understanding of the importance of the nurse in that patient's journey, that will be vital to the service developing over here. I also hope that they can continue to communicate with us when we're back in the UK and Ireland, and I hope that they can just understand that small changes can make huge outcomes and huge improvements overall.